Thank you for the invitation. I will explain you how I integrated the HIFU into my hospital practice. And I have a double practice, private and a public hospital practice. So I will focus in on the recurrent veins and perforators. I have no disclosure. So I have the chance to use Sonovein since September 2022. I was the first doctor to be trained, and then now we have 3 more vascular doctor. And I wanted to show in a real life occlusion of the patient I was seeing in my consultation that to test this new device. And we have there in Argenteuil Wound and Healing Center. So we recently published our results too, and as all the other doctors using HIFU, we showed a good result in the perforators, but also in generally in all the different situations, as long as you have the criteria to treat them by HIFU. In my hospital practice, I realized that using the HIFU, you do not. Your purpose is not just to reach the occlusion, as Paolo Casoni will tell you too, I think, after. That we realize that using HIFU, you will have reducing the volume of the vein, and you might get competent vein after treating, even if you were not able to occlude the vein. So, as in my private practice, most of the people they are reaching for have an aesthetic result. In my public practice, it's different. People have symptoms, and most of the time they didn't really need a reintervention just for the aesthetic outcome. So finally, I realized that for me, I include patients to be treated by HIFU for all the indication that need a long time of intervention, like new junction or residual trunk segment that are tortuous most of the time because of incomplete stripping, or the saphenous duplication in the tight. And with the HIFU, you do not have problem of tortuosity, so that's what makes the difference with the other technique. So I'm not doing a neocrossectomy anymore, because with the HIFU, you can treat them. Even if you don't treat them completely, you can use foam sclerotherapy to be able to treat them completely. But you will need some different time. You have to say to the patient that you will not be able, for the neocross, you will not be able to treat them in just one intervention. And the advantages of HIFU is that you don't have, because there is no incision, you don't have the risk of lymphoria or hemorrhagia. And so it's very important for the hostile scarpas. For the multidiscs, I have lots of elderly patients that have been operating many times, and they don't want to go back to the surgery. And also for the obese patient, as long as you have the criteria to include them, to treat them with the HIFU. So for me, the advantage of HIFU have also been seen with the treatment of perforator, as Mark Whitley said, and perineal varices also, as long as you can reach them with the device. You have a best cosmetic outcome, and of course it's a speed procedure, as it was just explained before. But in France, the disadvantages that is the cost, because for now it's a new technique, so there is no reimbursement. And you have restrictive inclusion criteria like the depths, and you have to be between 1 and 2 centimeters after compression of the vein. And be careful, as Ruben said just before, of the vital structure in the posterior acoustic shadow. So for me, in my public practice, in my practice generally, I see them most of the time in a private consultation or in my public consultation. But I would indicate all those different etiology for being treated by the HIFU. It's all the tortuous recurrences. Now I don't do surgery anymore. And for the residual saphenous trunk, as long as there is a tortuosity, because otherwise I would treat them by laser. And non-truncal incompetence like perforator on tight and the upper third of leg, because most of the time, unless they are obese, in the middle of the leg downer, you cannot reach them because of the depths. For the perineal varicose vein, but it's a bit, you have to ask your patient to do a bit of gymnastic be able to get the to get the vein in the correct area to treat it. And for the venous ulcer, as I said, we have a specific population in Argenteuil that are arteritic people, so with patients with PAD. And so I'm practicing hemodynamic approach for them. And most of the time they are under anticoagulant therapy, and they, of course, they are elderly people or fragile patients that cannot, they don't have lots of mobility. So after my treatment in my private practice, I'm asking my patient to walk more than 1 hour after the surgery, the day of the surgery. And then after 2 hours, 1 hour twice a day for the week after. So all elderly people that are not able to walk a lot, I prefer to treat them with the HIFU. And of course, with the patient request. Thank you.